Tennis elbow, also known as lateral epicondylitis, is a condition characterized by inflammations, pain, and tenderness on the outer side of the elbow. Despite its name, tennis elbow is not limited to tennis players and can affect anyone who engages in repetitive arm and wrist movement. The condition typically results from overuse or strain on the forearm muscles and tendons that attach to the lateral epicondyle. Extensor carpi radialis brevis plays a significant role in wrist extension. It originates from the lateral epicondyle and attaches to the base of the third metacarpal bone in the hand. Tennis elbow occurs when there is a repetitive stress on the forearm muscles and tendons, leading to microtear in the tissue. This can result from activities such as playing tennis, repetitive gripping, using a computer mouse, or other occupations that involve repetitive wrist and forearm movements. Symptoms of the tennis elbow may include pain and tenderness on the outer side of the elbow, weakened grip strength, or discomfort during activities that involve wrist and forearm movement. Treatments typically involve rest, ice, anti-inflammatory medications, and physical therapy. In severe cases, more advanced interventions such as braces, corticosteroid injections, or surgery may be considered. Okay, now we can start with the first article, investigating the effects of neuromobilization in lateral epicondylitis. It was seen that neuromobilization's technique had positive effects on pain in lateral epicondylitis. It is also understood that this effect lasts longer than conservative rehabilitation treatments that include eccentric strengthening exercise. However, no additional contributions of neuromobilizations to the grip strength, pinch strength, joint motion, and functional level of the upper extremity was found. 2021. The effect of scapular muscle strengthening on function recovery in patients with lateral elbow tendinopathy. For individuals with lateral elbow tendinopathy, both local treatment and local treatment with scapular muscular strengthening may be equally effective in improving pain, function, and grip strength in the context of a multimodal treatment program. 2021, proprioceptive elbow training reduced pain and improved function in painful lateral epicondylitis. It concluded that a 12 weeks proprioceptive training with the FlexBar improved pain, quality of life, grip strength, and vibration sensations in patients with painful lateral epicondylitis. The last one, 2022, Japanese Orthopedic Association Clinical Practice Guideline on the management of lateral epicondylitis of the humerus. After 1 year of follow-up, physiotherapy showed more beneficial effects than steroid injections or wait-and-see approach intervention. Multiple physiotherapy interventions have been recommended for treating lateral epicondylitis, and the treatment efficacy has also been compared. However, there is no consensus on the most effective physiotherapy technique.